Here is a sobering statistic. Cancer deaths on the continent of Africa are forecast to go up a whopping 70% over the next 12 years if we don't do something. And that's where Jennifer Dent, the Executive Director of BioVentures for Global Health, or BVGH for short, comes in. Thanks for being here at the BioBuzz Center.
Thank you, Mike.
Tell us about this cancer crisis, if you will, in Africa.
Well, as you say, Mike, cancer is increasing dramatically on the African continent, and the continent doesn't have the resources to address the cancer crisis. Cancer currently kills 60% more Africans every year than malaria does.
Wow. Most people aren't aware of that.
They're not thinking about that.
So what is your organization doing to try to make a dent, to play on your last name, if you will?
So we've launched the African Access Initiative, a program and partnership between African governments and companies and academics and healthcare professionals to improve and provide access to cancer medicines, technologies, and to build capacity in African countries to actually better treat their cancer patients and care for their cancer patients.
What kind of progress has your organization made in the short time that it has launched this major initiative, and what is your plan in the future? What's your goal?
So we launched the African Access Initiative here at the Bio International Convention 1 year ago, and we've made a tremendous amount of progress over the last year. We launched with 4 countries on board as partnerships with the Ministries of Health of Nigeria, Cote d'Ivoire, Cameroon, and Kenya. We brought Rwanda on board in November as our 5th country, and we've brought on board 32 cancer treating hospitals across those 5 countries now. We've implemented a comprehensive needs assessment at each of those 32 hospitals, and we've received the results of 21 needs assessments. And these needs assessments provide us with the information we need to understand how cancer patients are currently presenting, how the hospitals and the hospital teams are actually managing the cancer patients, and importantly, what are the gaps in their capacity from a technology, a diagnostic, or pathology lab capacity standpoint, also a medicines standpoint. So which medicines do they currently have available in their hospitals to treat patients? Are those medicines affordable? Are they sustainable? Are they high quality? So we've gathered this information from the 21 hospitals. We've started to share that information in customized reports to the ministers of health in those countries, so that information can support their national cancer control plans, but also importantly with companies, so companies can understand how cancer patients are presenting in African countries and which of their technologies or medicines are really desperately needed in those hospitals to treat patients and ultimately have an immediate impact on saving patients' lives.
Well, Jennifer Dent with BioVentures for Global Health, continued best wishes in this noble mission in trying to address this major problem. And thanks for joining us here at the BioBuzz Center.